Over the past 10 years or so as the Minister of Health, I think one of the biggest achievements will be the decrease in maternal mortality rates, where we are now amongst the world leaders in how to reduce maternal mortality rates. But outside of that, I think the country is benefiting from not only the structures we built, Point Fortin Hospital, Arima, Sangre Grande, New Central Block. We have made some fundamental changes to the way we deliver healthcare services in the past 2 years with the introduction of technology and digitization of health. What does that mean? One of the biggest complaints that people have, especially when you go to a clinic and you have to wait a long time, is lost paper files. We have started a process of digitizing those files so that you don't have to wait for a paper file to come. Also, the technological revolution in health over the past 2 years revolves around 3 main deliverables. For those patients who have to take their x-rays, their mammograms, their CTs, their MRIs, we now have the capacity to view your images in any facility that you are, so that you fall ill in San Fernando, but you took a CT in Port of Spain yesterday, we can see that CT. So we don't have to re-image you. You don't have to wait for a second CT. That type of integration of technology is already reaping benefits. Secondly, the same way we can view your images across the country wherever you are, we can now view your blood work so that we don't have to redraw blood a second time. So some of the pillars we are working on is HIV/AIDS, decentralization of mental health, NCDs, and as you said, moving away from this chit-based system of blood donation to a voluntary system. The chit-based system was inequitable, it was traumatic, where you have to go and search out blood. In getting people to volunteer to donate blood on a voluntary basis, it's a tough fight because you are asking people to give up something and get nothing in return. That's called altruism, where I do something out of the goodness of my heart and I expect nothing in return. Again, it's going to be a long fight. So, before we started this system, 0.5% of the blood collected in Trinidad and Tobago was that system, altruism. I just donate blood. I used to donate blood every 6 months out of the goodness of my heart for the past 30 years. It's now up to 15%. But it's still not enough. But at the same time, what we have been doing in using newer surgical techniques, which are bloodless, using more laparoscopic surgeries, which require less blood, the demand for blood is coming down, but we still have a gap. Bringing down maternal mortality rates. That is the biggest achievement. And we achieved our Sustainable Development Goals set by the United Nations for achieving those targets. Those targets were supposed to have been achieved by 2030. We achieved them in 2018, 12 years ahead of schedule. So Trinidad and Tobago should be absolutely proud of that.